Hi, this is John Hansbrough with the LBL Group. Here to give you some updates on things going on with health insurance and things going on in the benefits world. I'll go over a little bit our Tuesday recap that gets sent out to email, so if you're interested in that, please reach out to me and you can get added to the list. One thing I wanted to talk about was a recent article put out by the Wall Street Journal. Health insurers offer premium discounts. So a lot of the health insurance companies right now, they've been, still continuing to charge health insurance premiums to both individual and group clients. But on the backside, they're not having to pay as much to hospitals, right? You're seeing a lot of reports now about hospitals operating in the negative now for a couple months as COVID-19 cuts down on the number of elective surgeries hospitals are able to perform. And unfortunately, those are a big profit driver for hospitals. So elective surgeries don't happen. Health insurance companies are taking in premium, but they're not putting it out into hospitals. So the health insurance companies are sitting on a lot of cash. That's why you saw a report last month. The UHC said they're returning about $1.5 billion to customers. And this article that I'm going to send out, this one is about Aetna. An Aetna situation, Aetna is going to be providing about $2.5 billion to customers. That's great. It's obviously going to be somewhat of a relief for the companies and individuals who are getting credits. Should be showing up sometime in July, but it's going to cause a couple questions. So first off, what's going to happen for those groups getting money? How are they going to return that to their employees if it's a share of employee premiums, or are they going to keep some of the money? And this is something that comes up frequently with clients of ours when they receive rebates after a plan year due to medical loss ratios, something called MLRs. That's a portion of the ACA that a lot of people aren't really familiar with. It's actually, we believe, a cost driver for why costs have been increasing in health insurance over the last decade since the ACA was enacted. Is what MLRs are is that health insurance companies are required to pay a certain portion of the premiums they collect, a certain portion of the premiums to claims. So for every dollar they receive in premiums, they're supposed to spend 80 cents of that dollar on claims in the small group market, and in large groups, supposed to spend 85 cents. And so at the end of the year, maybe a group didn't have that many claims, or the health insurance company received too much money in premiums compared to what they spent in claims. They're going to then return some money back to their clients. That gets a little complicated in how we attribute that to, or how companies attribute that to their employees. And as brokers, we help with that a little bit, trying to figure out who should get what. It can get a little messy, and we think that's going to come up again as these credits start getting rolled out. So you'd think, if you have an employee on the books up until this month, and then next month you get a credit for your future premiums, that's a benefit maybe they might be entitled to. We're not sure. We're waiting for guidance on that. But that's one thing to keep an eye on for sure. Beyond that, other things going on in the benefits world is that the PPP Flexibility Act was signed into law on Friday. So you should have gotten some information on that. That basically is going to provide a little bit more relief to companies who are receiving PPP loans. It's lowering their required spend on payroll from 75% to 60%. It's also extending their payment window on when they should be spending those funds, and a few other provisions to keep an eye on. If you have any questions on those, reach out to us. Big resource we've been using a lot for our clients lately have been our compliance, labor, and employment attorneys. So if you have any questions about those fields, please reach out to us and we can direct you to our attorneys who can help you. Pro bono is one of the benefits we provide to all of our clients. And if there are any questions on those things, feel free to reach out. This has been John Hansbrough with the LBL Group. Talk to you soon. Bye.